Welcome, Warriors. I'm JoeJoe Fusion, soon to be Spinal Fusion Warrior. Some of you know what that is, others that are watching it don't. Those of you that don't know what it is, you're probably thinking, how can I join this cool sounding and probably exclusive club? Well, there are two ways. The first, you're chosen by God. And if you're chosen by God, things just kind of happen naturally and poof. The second way, and it's much like knighting, you have to find somebody who's already a Spinal Fusion Warrior and have them hit you with their car. Now, there's no guarantees our knighting process isn't 100%. However, you'll end up a warrior of some type. I would say the chances of internal hemorrhaging warrior are high. Shattered leg warrior, I would say those chances are high. You'll be a warrior of some sort. And then the lucky few of you that are hit in just the right way, Spinal Fusion Warrior. Seriously though, what a Spinal Fusion Warrior is someone who has gone through spinal fusion surgery. This video is going to be my story up to this point. I have not yet had surgery, but it's not too far off. Basically, what happened and why I need surgery. So, back in late September, early October, all of a sudden it felt like I had a severe pain, and it felt like I pulled a trap muscle. It hurt like hell. And then I also had pain coming from my neck, and the pain was, I wouldn't say it was severe, but it was unrelenting. There was no relief, which is horrible. Even if the pain's not that bad, the fact that there's no relief is what gets you. So I went to the doctor thinking, okay, I pulled the trap. I went to an ortho and, have him give me maybe some muscle relaxers or something. I went there and they're like, all right, well, your x-ray shows that your back appears to be in spasm, your neck is straight, all this wonderful stuff. They checked my reflexes and they said, well, you're hyper-reflexive on your right side. We should do an MRI. So I'm like, whatever. So go for the MRI and then go for the follow-up appointment. And she comes in and she's looking at me because I'm sitting there and I look normal, not in pain or anything. And she said, how are you feeling? And I said, I'm feeling all right. She said, what do you mean all right? You pain? I said, no, not in pain. By that time, my pain was pretty much gone because what had ended up happening was I herniated a disc. Well, that had probably healed up quite a bit by the time the follow-up for my MRI happened. I said, no, I feel pretty good. I actually feel real good. And she said, well, your whole spine is messed up, or your whole cervical spine is messed up. I said, what do you mean, how messed up? And she said, you're going to need surgery. And I said, wait, what surgery? What kind of surgery? She said, fusion. And I remember seeing stuff like on the TV about fusion and all this other wonderful, and all this stuff on the procedure. Couldn't remember a whole lot of it. But I remember seeing that they basically take the disc from in between your vertebrae and they put bone in where your disc was, and then your body naturally fuses the two vertebrae together. So when she said that I needed fusion surgery on my neck, the first thing I thought about was, am I gonna be Batman? I don't know if you guys remember Michael Keaton's Batman. All he did was this. He couldn't move his head or neck or anything like that. And she said, my ortho is a woman, and she said no. She said, it looks like you'll need a few levels, and and you'll lose some motion, but you may not even notice it that much. So I scheduled a surgical consult, and for those of you going through this, I would say get at least 2 opinions. Me going into it, I said I was going to get at least 3. So the first guy I went to, he said, yeah, we'll do your C3, 4, 5, 5, 6, and you should be good to go. We'll do it through the front, which is called ACDF, which is anterior cervical discectomy and fusion. And he said we should be able to, compress it pretty well, and you may not even notice too much any loss of motion. So I was like, okay. A few weeks later, I went for the second opinion, and that's who my surgeon is now. I went with the second guy. And he said, all right, yeah, no. He agreed with what the first surgeon said. And he said, but let's go ahead and take a look at your facet joints in the back. Let's get a scan of those just to make sure that we can do what we want to do. We don't go in, find any surprises. I was like, okay. So we get that scan back. And he basically told me I have OPLL in the back, which, if I'm remembering correctly means ossification of the posterior longitudinal ligament. Basically, there's a ligament that runs in front of your spine, and it runs the whole way through the spine. Mine had calcified, basically turned into bone. So I have spinal stenosis, which basically means in your spinal canal, you have so much room to deal with, right? Your cord runs through your spinal canal. Now, when you start to develop bone spurs, and this can happen with age, this can be a result of degenerative disc disease, it can be a bunch of different things. Well, one of the things that can happen is you can develop bone spurs on the inside of the spinal canal. And over time, these things will grow. They're slow growing. It takes time. You could have stenosis for years and years and not know. Well, as the bone grows, so if you have that much, if your spinal cord is running through it and you now have bone growing in, it pinches, and this is probably not the best way to explain this, but it pinches off your spinal canal. And it's called spinal cord compression. And I do have spinal cord compression. The way the surgeon put it was, my cord is feeling it, but he does not believe there is damage done to it yet. Now, there's one thing you have to remember with the spinal cord. Any of the nerve roots that come off the spinal cord, they can heal. Meaning that if there's certain extensive damage done to them, they can heal. Your main cord, once there's damage done, that doesn't heal. So if damage is done, the symptoms you have at that point, you may have for the rest of your life. So right now, what they want to do is they want to go in through the back. Because of the fact that ligament is calcified, the only way they can get to it is from the back. So they're going to go in through the back. They're going to decompress. I'm going to have what's called posterior cervical discectomy and fusion with laminectomy. And let me do this. We'll pull up a cervical spine real quick. All right, so as you can see, cervical spine has vertebrae. At the top, that C1 is also known as the atlas. Then you get into the C2, C3 through C7. And then that T1 that's on that picture is basically the beginning of the thoracic. The extent of the stenosis I have runs from C2 all the way through to C7. It's worse at C4 and 5, but in order to stop the bone from growing, they need to cut into the back of me. They're going to remove the lamina, which is those, if you look at the vertebrae, you see those spiky things coming off of it, that's your lamina. They're going to remove that, and that's in order to give my cord enough room so that it's no longer compressed. The other thing they're going, and that's the laminectomy part of the surgery. The other thing they're going to do is they're going to remove every disc from in between C2 and C3 all the way to T1 and T2, which is the beginning of your thoracic spine. They're removing all those discs. They're going to take bone and put them into place of those discs, and then over time my body will basically fuse my neck into one big solid bone. Now, the issue with that is I'm going to lose at least 50% of the movement in my neck. So as he's telling me all this, hey, you have calcification. We can't do this from the front. We can only do it from the back. And you're looking at all the way from C2 to T2, and we got to fuse the whole thing. And the surgeon I have is great. He knew what he was dropping on me was a bombshell, and he explained it to me. And he said, "Look, you're going to lose motion. He said 50% side to side. So he said you'll probably only be able to do like this, and then up. I could probably do that. And then he said down, probably that, which you may not be able to see, but it's life changing. I did ask. I said, hey, I work for a living. Told him what I did, and he said, oh no, once it's all healed, he said, yeah, you'll have to get used to the range of motion. He said, but you can get back to a completely normal life. He said, yeah, you'll have to adjust for certain things, like driving. I got some blind side mirrors or blind spot mirrors, put them on the car. I'm going to put a backup camera on the car to help me drive, but I can drive. It's just to be a little harder because driving, as far as daily activities go, it uses the most of your neck's range of motion. I think they said something like 90% because, as I'm sure some of you know, when you're trying to check, to see if someone's coming, your head's all the way, almost as far as it can go. And even then, you're still probably moving a little bit with your, twisting with your back, especially at certain Y sections. The ones where you're coming up, you're like this. So you're here, and then you got to kind of look all the way down back behind you. But anyway, so that's what they want to do. So they want to remove my lamina and then fuse C2 to T2. And let me show you this. This isn't my MRI. It's just an example I found. I do have my MRI. I have no idea how to get the pictures off the disc. I can view the pictures, but I can't find the one that actually shows what I need to show. But anyway, here's an example of spinal stenosis. And look towards the bottom of the picture, like in the middle. You'll see it's like white, then it's gray, then it's white. Well, that gray part is the spinal cord. The white on either side is the spinal fluid. Now, if you look up towards the top, you'll notice it almost looks like little waves in the bone. Those are bone spurs, and they're starting to pinch the cord, and you can see that. And in certain parts, you don't even see the spinal fluid. That's not good, and that's usually the point at which you start to experience symptoms, and when you need to start thinking about surgery. And actually, possibly even before that point, you need to start thinking about it. So in my case, if you look at the top, I wish I could show you. I don't have. It's not picking up the mouse. But at the top, you'll notice a little triangle type bone, and then right underneath that, those little black lines in between the bones. Those are your discs. I need from C2, which is that right underneath that triangle point, all the way down, if you count, to T2. So you just count the discs down and you'll see what's getting fused on me. And basically, my whole neck up to that point is going to be bone. So that's what I'm having done. It's when I was first told initially, when they said, hey, you need this and it's going to be a 3 or 4 level fusion, I went into shock, like straight up shock. I've never experienced shock before, but I went into shock. I'd get out of work, didn't want to do anything, just wanted to go home and just lay down, just watch some mindless TV, lay down and go to sleep. Then I got my mind wrapped around it. I was like, it's not going to be that bad. We'll be okay. It'll be fine. Well, then they said, hey, it's worse than we thought. Like I said, the ligament in the back is calcified. You're going to need significant fusion. You went into shock again. Because, first it's like, all right, it's not so bad. I'll still be able to move my neck decent. I might notice 20 or 25% loss. That now they're saying, well, you're going to lose at least half of it. And there's stuff you're going to have to get used to doing in a different way and things like that. And if it wasn't for, I found a couple groups on Facebook, and I'll probably talk about them in another video. And if it wasn't for those groups and my wife supporting me, I don't know what I'd do without her, to be honest. I'd probably still be in shock I'd be miserable to be around. And I mean, I'm not going to lie. There's time. I'm willing to bet that, I mean, people notice, right, when you're in a funk. But there's also times when I hope I don't appear to be in a funk, but, you know, I'm just acting. Like, I am in a funk, but I'm trying to act normal or act funny, and that's more, it's just more to, you know, for the benefit of the people around me. I don't want them to be concerned. I mean, keep in mind, recently, I've had a month or so to wrap my head around, hey, you need this, and it's big, and it's life-changing. So I feel a lot better now, especially in the groups that I'm in. I've found a couple people that have gone through what I've gone through, and they're living relatively normal lives, pretty much completely normal, except they had to get used to some things. And I also met, there's a guy I met who's going through the exact same thing as me for the exact same reasons. I did look into, like I said, and I asked every question I could. Is there any way we can save the disc at C2-3 if it's not bad, or, you know, to where I don't need to have that fused? And it's all been explained to me that the best approach is to fuse all of it. I've asked the questions. I have looked into, do I need surgery? And I do. And as I said, because if I wait too much longer and the cord gets damaged, there's no healing from that. There may not be any healing from that. So as I develop symptoms, there's a chance it may not go away. So if you stumbled across this video because you have to go through this, and I hope your surgeon told you this, if you have symptoms and you're seeing, okay, you have symptoms, you talk to your surgeon, right? Ask him, does it look like there's any damage done to my cord? On the MRI, I believe there's signaling that they can see on the MRI, and they'll know if there's an issue with signaling. If you have an issue with signaling, you may have damage to the cord. You could have a bruised cord or something like that. I don't have that, but ask your surgeon, does it look like there's damage? And how bad is it? And if he said there's compression, it doesn't look like there's damage yet, and any good surgeon will say, we can watch this. And my surgeon told me that, hey, we can watch this, and then when you start to become more symptomatic, we can deal with it. However, and I asked him this, and he said, and he agreed, if there's damage done, I could be stuck with those symptoms for the rest of my life, even if there's surgery. He said, right now, what we're looking for in surgery is, one, to prevent any more significant symptoms. He says, I think your symptoms should go away, but if they don't, at least you won't have any of the more major ones. He said, so this surgery is to prevent the onset of major symptoms at the very least. And he said, I think in your case it'll also relieve your current symptoms. But he said, just be aware, there's a chance they might not go away, but he says it doesn't look like it's that bad yet. So be aware of that. Like, I see a lot of people, especially in the group I'm in, trying to put off surgery. And in some cases, it's the right choice if you've asked the right questions. But just remember, if your cord is being pinched, and especially if you have symptoms, you're playing with fire. Especially if it's in the central canal. I'm talking about where you're, compression of your main cord. If they say you need surgery, try not to put it off. I mean, don't rush out and get surgery. Like I said, try and get 3 opinions. And the third doctor I saw, also a phenomenal surgeon, but I decided to stay with the second one because he's amazing. But the third doctor agreed with the same assessment as the second surgeon. The third surgeon agreed with the second surgeon. So I'm pretty comfortable in that this is what I need done. I'm also lucky enough that my sister is a surgical nurse, and she deals mainly with spinal surgeries. So I know that she's asked some questions for me, or the doctors that she works with, and they've said, yeah, this is kind of what you have to do. So I've kind of gotten a fourth opinion in a sense, if you look at it that way. If I could have avoided this, getting it done, I would have. So as long as my cord wasn't in jeopardy, like if they said, hey, you have, because you can have mild stenosis and the cord is fine, it's just your canal is getting narrower. When they say, hey, you have, stenosis, it doesn't necessarily mean your cord is compressed and you're going to need surgery. It just means, hey, this has started, you may need surgery at some point. The other thing with me, I don't know if I know I'm babbling, but I don't know if I mentioned it. I also was born with a congenitally narrow spinal canal. So whereas many people, maybe their canal's that big, mine's that big. So now that the spurs are growing, there wasn't that much room to play with. So I'm dealing with this a lot sooner than most people. If the research I've done is correct, spinal stenosis is something that happens to everybody. It's just some never have to deal with it or deal with the symptoms, or they don't live long enough to have to deal with it. Basically, as we get older, our discs degenerate. It's just a fact. So if you ever hear I heard my grandmother used to talk about how they shrunk a little bit and all this. Well, that's basically because over time your discs slowly shrink. It's just wear and tear. The closer they get together, the more chance there is of bone spurs starting to grow. So now some people are able to keep are able to keep their disc space at relatively healthy heights through good posture, good being at a healthy weight, and all kinds of other things, exercise, all that wonderful stuff, and their spine stays relatively healthy. They still have this narrowing, but it's nowhere near as bad. A lot of people notice issues first. It's either in the lumbar or the cervical. You hear a lot of people talking about sciatica. Sciatica isn't a condition. It's actually a set of symptoms. And it has to do with compression of your sciatic nerve. And in a lot of cases, that's because your discs have narrowed so much that now, I believe it's called the foramina, which is the where your nerve roots exit off the main cord out of the spine. Well, when your discs reduce, the bone starts pressing on those nerve roots. And that could just be something you have. You may never need anything done. Some people end up with severe back pain, or they end up with stenosis, even central canal stenosis in their lumbar, and they do need surgery. I've heard people saying, avoid surgery, and you don't want back surgery, you don't want neck surgery. Well, in my case, if I don't have neck surgery, next stop is I'm paralyzed, then I die. Your breathing muscles are, your cord, especially the portion of it that helps in breathing, runs from your, or especially the muscles involved in breathing, runs from your cervical through several levels of the thoracic. If I don't have surgery, I can't walk, I can't use my arms, and then I can't breathe. So I don't have an option. This is basically, at the point that this was caught on me, this is my option. So, and I actually have a gentleman I work with who's going through maybe not as severe a case, and he's also much older than me, but he's got some stuff going on in his neck, and he's been asking me some questions because I'm a little further along in the process than he is, and I recommended my current doctor to him and said, hey, this guy's great, you should go see him, and he'll give you your options. But basically that's what's going on with me. Well, I don't know how long this video ended up being. I can probably, oh no, it doesn't tell me, but that's my story. If you're going through this, the one thing I can tell you is this procedure is extremely common, even the more significant fusions, like mine, where they're going all the way from C2 to T2. If you're going through a few levels like C2 to C4 or C4 to C7, it's nowhere near as bad. I mean, don't get me wrong, any surgery is still not good, but it's better than having a huge, like 8 levels of fusion. It's very common. The complications are rare. Death is one of the complications, but in the research I found, it's nearly non-existent. One of the biggest things, or one of the main things to know about, and the chances of this are between 5 and 10%, is if you need work or anything done at C5, especially if they remove the lamina, there is a side effect called C5 palsy. And what that means in most cases, you lose the ability of your to move your shoulder muscles, right? So you won't be able to lift your shoulders. You're stuck to moving your arms or whatever. However, and in the one surgeon I met with, the third one, he was telling me he's done hundreds, if not thousands, of these surgeries. And he said that in all the cases of C5 palsy he's ever seen, there has only been one in which there had not been full recovery of that within 6 months. And even that one has partial movement. And what causes that, the C5 palsy, is when they decompress your cord, especially if they remove the lamina, your cord tends to drift back a little bit. And I don't know the science behind it. I didn't do much research. I just know that it's something that could happen. And it is more likely the more compressed your cord was to begin with. So if you are in the camp to where you kind of need surgery, but you're putting it off, the worse that gets, one, you could be stuck with symptoms the rest of your life, and then two, you're at a higher risk of developing C5 palsy. And like I said, that's more temporary, but still something that makes recovery a little more difficult. The other thing is, don't try to internalize everything. Don't try to deal with this on your own. I'm a big dumb idiot, right? I get this major stuff, and I try not to show people that I'm worried or I'm scared, even though I am. Bring other people in. You have friends, you have family. That's your support network. There are groups you can find for ACDF if they go in through the front, or PCDF if they go in through the back through Facebook. Like I said in another video, I'll probably let you know what those two groups are. But if you do a Facebook search for ACDF or PCDF, you'll get groups that come up. The two I'm in, I believe, were the first that came up in the search. But find people that are that have gone through what you went through, or are going through what you went through. I can't tell you how great it's been, one, talking to people that went through it, and just telling me, like, hey, yeah, stuff can go wrong, but a lot of times it doesn't, and you're most likely going to be okay. You may have to get used to some different things, but it's going to be okay. And the one guy I found, like I said, to be able to talk to him as we're going through the same thing, even so much as he got his neck brace that he's going to be in after surgery, and it basically keeps your neck, and it extends down to the front and the back. And he did the wipe your ass test, which, all right, he wore the collar around for a while just to see how it would impact his life. While he has this collar on, will he be able to lay down? Will he be able to do stuff? And one of those being, hey, can I wipe my own ass? Good news, yes you can. So yay. I'll do the same thing when I get mine. And the one thing he said is laying in bed is going to be rough in this collar. And he did get a wedge pillow, which is kind of like those triangle pillows you see. And he said that was rough. And basically said it seems like the best bet for us is going to be a recliner. I do have a love seat that reclines, so I'll use that. Anyway, I'm going to stop the rambling here. This video, it's going on 30 minutes. Wow, that's way longer than I thought it would be. Hopefully what I said, keep in mind, I hope to be clearer in future videos. This was just me getting everything off my chest. It was kind of cathartic for me. Just letting people know what I'm going through, what I'm thinking. I appreciate all the support I've gotten. My job, the guys I work with, my management has been phenomenal. Like, I was worried about a lot of stuff, and even they're like, it's fine. It's going to be fine. We'll get it taken care of. Your job will be here when you get back. I have short-term disability, so that helps. Yeah, and like I said, if it wasn't for my wife, the guys I work with, and the groups I'm in, I'd probably be a nervous wreck and, this huge bummed out mess. But I'm actually kind of happy, not happy about the surgery, but, right now I'm okay. So, my name is JoeJoe Fusion, reminding you, you don't have to be the best warrior, just be the best warrior that you can be.